Okay, today I have, can you state your name and date of birth?
Caroline Smith, 5/13/1942.
She is a 78,
77.
77 year old Caucasian female. I'm going to be doing a complete head to toe physical assessment on ya. So I'm going to start off with hand sanitizer first, because hand hygiene is important. Alright, how are you feeling today?
Thought maybe I was engaged.
No. How are you feeling today?
Pretty good, pretty good. Other than the cold weather.
Okay, do you have any other pain? Anything that you feel wrong today?
No.
Alright. I'll put my gloves on for protection. I'm going to start with the head first. So I'm just going to feel around your head and see if there's any abnormalities, any lesions, any redness, any deformities.
Well, I'm glad I didn't do my hair.
I don't see any lesions or moles or deformities or anything like that. And I'm going to go to the front of her head.
I'm going to take my glasses off.
Yeah, go ahead. And you wear glasses all the time?
Mm-hmm.
Her face is symmetric. Can you smile for me? Alright, and then close your eyes real tight. Alright, and it's symmetric. So if she had a stroke or something like that, it'd be uneven, but you didn't, so you're all good.
Thank God, huh?
Next, I'm going to check her pupils to see if they're reactive to light and round. So if you could stare at my nose for me. Alright, they both are round and reactive to light, so that's good. Gonna check out your mouth now. You know, stick your tongue out at me. Okay, her uvula is midline, so that's good. She doesn't have any whiteness on her tongue or nothing, so she doesn't have any thrush or anything like that. Her membranes are pink and moist, so that's good. Alright, go ahead and close your eyes. Alright. I'm gonna look up your nose a little by now, okay?
Okay.
Okay, so her septum is midline, so that's good. It's not deviated. So you haven't had any nose trauma or anything like that. Check out your ears.
Hope they're clean.
I'm looking a little bit, but I don't have an otoscope, so I can't look fully in, but there's no deformities on the outside, no bumps. It's not red or anything like that. Check on the other side. This one doesn't have any deformities or anything either. Now I'm going to touch around your neck and feel your lymph nodes for any bumps or anything like that. Alright, so she doesn't appear to have any swollen nose, which could be a sign if there's inflammation or anything like that. I'm going to check your pulses, okay? She has +2 pulses on that side, so I'm going to check this side now. This side's strong also. Gonna check your trachea. It does appear to be midline also. I'm gonna check your blood pressure, okay?
Okay.
Doesn't matter which arm I check it on?
I don't think so.
Okay. You haven't had any, like, blood clots,
No,
anything like that?
not that I'm aware of.
Alright. Gonna pump up a little tight, okay?
Mm-hmm.
I got 120/78. Is that around what you normally run?
Yeah, pretty. It's usually good.
Okay. Alright, now I'm gonna feel down your sternum also. There's the angled buoy right there. Gonna take a listen to your heart now, okay?
Okay.
Starting over Alright, I didn't hear any murmurs or any abnormal sounds, so that's good. Gonna take a listen to your lungs in the back. I'll tell you when to take a deep breath, okay?
Mm-hmm.
Deep breath. And out. I'm gonna listen anteriorly now. Also take a deep breath. Listen. Alright. Your lungs sound clear. There's no wheezes or any abnormal sounds there. Gonna listen to your belly now, okay? And you do have active bowel sounds, so that is good also. Do you move your bowels regularly?
Pretty much.
Alright. Now I'm gonna check down your arms and everything. There's no lumps or anything like that. Check your hands. Gonna check your capillary refill. That's good. Gonna check your skin turgor here. It's a little delayed, but that's common with age also. Gonna check this. Capillary refill here. It's good on this side also. Alright, I'm gonna check your turgor up here also, okay?
Is there a reason for it to be, like you said, it's delayed? Is there a reason for that?
It's just with age and how your skin kind of gets like elasticy.
Because I wondered if it was
older.
not enough water, or, you know, does that have anything to do with it?
It could also be a little dehydrated, but I think it's mostly with age also, okay? Alright, now I'm gonna go down to your legs. There's no abnormalities here. There's no swelling. When I press in, there's no indentation here, so that's how you can tell if you got fluid in your legs or anything like that. Alright, now I'm going to palpate your stomach a little bit, okay? I'm going to go soft and then it'll be a little deeper, okay? You tell me if anything's hurting or anything like that. Have any pain or anything? Just going to take a peek at your stomach, okay? So your stomach is flat and symmetric. She does have a history of diverticulosis, and you're not feeling any symptoms now, right? Okay. Gonna press in harder now, okay? Having any pain? Don't feel any abnormalities, any bumps or swelling or anything like that. Alright, you can go ahead and sit out for me. Gonna check your range of motion in your arms, okay? So, put them out straight like this. Alright, go ahead and put them down. There's no drifting, which would also be a sign if she has a stroke, but they were both symmetric and she was able to hold them, so that's good. Can you bend your wrist like this? Alright, good. She's able to extend and everything. Can you put your arms out like that? How about this your side? Yeah. Alright, no hurt? Doesn't hurt? Alright, how about roll your shoulders? Alright, so she has full range of motion. Now I'm going to go down to the legs again. Alright, can you try and pull back? Alright, good. I'll try and push forward. Alright, good. So she does have good strength in her legs. How about, can you roll your ankles? She doesn't have any, you don't have any pain or anything like that? Okay, good. Alright, can you grab my hands and squeeze? Alright, so she has good grasp also. Now I'm going to check out your feet, okay? You can come closer.
So you can see my ugly toes.
Alright, now I'm going to check her pulses in her feet. She has good pedal pulses, +2. Gonna check out your toes. She does have some curving of the toes. How long have you had that?
Most of my life. This one is, this is worse now that I've gotten older, but I'm not even sure how long it's been like that, but it has gotten worse since I got older. But
do you wear anything in between your toes to try and separate them or anything? Okay. Does it have any pain or anything like that?
sometimes it bothers me.
Okay.
I think it must depend on how much I walk or something.
Okay.
But most of the time it doesn't bother me.
Okay. Now I'm going to ask you some questions. Where are we right now?
In my house.
What's the month?
December
How about
4th,
How about the year?
2019.
And who's the president?
Trump.
So she's alert and oriented times 4. She knows where she is and everything like that. Alright, can you stand up for me? Can you walk forward a little bit? So she does have a steady gait and you don't use a walker or cane or nothing like that, so that's good. And you you said before you've had back pain. Are you having any back pain now?
No, it has been bothering me this week, but I had a massage appointment this morning, so that,
Okay, so it's good now.
yeah.
I'm just gonna check out your back a little bit, okay?
Mhm.
Alright, so it's not red, doesn't have any abnormal moles or anything like that. No swelling. Everything appears to be normal. Alright, do you have any questions for me?
Yeah.
Okay.
Why did they take ranitidine off of the counter?
That's a good question, but I'm not a pharmacist.
I thought maybe since you were a nurse you'd know.
No, I didn't even know it was over the counter. I thought that was always prescription.
No, there's over the counter because I've been taking 150, 250 milligrams at night when I go to bed
Yeah.
at Dr. Raka's request.
Mm-hmm.
And when I went to get it, there was none on the shelf.
You haven't had, it's not like you don't get it filled.
Well,
By him.
Papa gets his, he takes it also, and he gets his filled through the VA. And I've called about it,
Mm-hmm.
and I've ordered it, and he never got it. So I thought they just forgot. So I called the VA clinic in Du Bois.
Mm-hmm.
The girl never told me that they took it off the counter. Then I stopped at the dollar store and was going to get some.
Yeah.
They didn't have any on the counter there. So the next time I went to Walmart, I was checking there, and I even asked a girl about it. Well,
Yeah.
they're not saying why it's not on the counter, but they're saying, oh, that's the one isn't that the one they took off the market? But they aren't
So you
saying
can't get it at all now?
No.
Oh.
So I ended up getting Tagamet.
I know sometimes with medications, if they've been on the market for a while, they take them off and they have like a new, because they only have the brand name for so long. So maybe it was expired, like they couldn't use it anymore, so they came out with a new medication with a different name, but does the same properties and everything, but they just couldn't like use that anymore. I'm not sure.
I thought maybe there was a reason, health-wise.
Yeah, I haven't heard anything, because if there's a recall, usually like we would know about it, and you would be told about it too, to like not have it, not take it anymore or anything. But all right, I'm done with the assessment.